Most bones in our body have 4 layers. Bone marrow is one of these layers. The periosteum is the outer layer that covers the entire bone. The cortical layer looks spongy, but is dense and strong, made mostly of calcium salts. It is also called compact bone. Moving towards the center is the cancellous layer. It is also spongy-looking, but softer and weaker than compact bone. In the center of the bone is the marrow. It is thick and jelly-like in texture, protected by the other layers. There are 2 types of bone marrow, red and yellow. Red bone marrow makes red blood cells and other cells that make up the immune system. Yellow bone marrow makes fats, cartilage, and bone.
A stem cell is one of the many cells made by red bone marrow. It is often called the miracle cell and acts differently than the other cells in the body. Adult stem cells can make copies of themselves. New stem cells that can grow into many different cell types, which perform specific functions. One of these new cells is the hematopoietic stem cell, or HSC. It is called a specialized stem cell because its main function is to make blood cells that keep the body alive and healthy. Hematopoietic stem cells are found in both bone marrow and peripheral blood, the blood that circulates through the body. Blood in the umbilical cord also contains HSCs. Cells from any of these sources can be used in bone marrow transplants. Hematopoietic stem cells make the 3 primary blood cells found in the body: red blood cells, white blood cells, and platelets. Red blood cells carry oxygen to all parts of the body. White blood cells fight infection and are part of the immune system. Platelets help the blood to clot, which helps to stop bleeding. Hematopoietic stem cells constantly renew blood, making millions of new blood cells each day. Healthy bone marrow and blood cells are needed to keep the body alive. However, bone marrow can be destroyed by disease, chemotherapy, and radiation. Blood and marrow transplants, or BMT, are used to fix the damaged bone marrow by replacing the unhealthy hematopoietic stem cells.
Blood and marrow stem cell transplants are used for patients whose bone marrow cannot make enough healthy blood cells. Severe blood disease, such as sickle cell anemia, and aggressive cancers like leukemia and lymphoma are 2 examples. Hematopoietic stem cells are needed for the transplants and can either come from the patient, called an autologous transplant, or from a donor, called an allogeneic transplant. The transplant process at Moffitt Cancer Center involves several stages: pre-transplant evaluation, transplant preparation, conditioning chemotherapy, transplantation, recovery and engraftment, and long-term follow-up and return to home. The pre-transplant evaluation involves vital organ testing to make sure the patient is healthy enough to have the transplant. It includes testing of the heart and lungs, lab work, and disease staging, such as a biopsy. Transplant preparation includes meeting with the patient's medical team, a social worker, a psychologist, and a pharmacist in order to plan for the transplant. It also includes identifying a caregiver for the patient. Moffitt requires that the patient have a primary caregiver with them 24 hours a day to assist with care during the outpatient phases of the patient's treatment plan. The duration of the caregiver requirement is determined by the patient's personalized treatment plan. The patient may be asked to remain local to Moffitt Cancer Center during and after their transplant and might require local lodging. The social worker will discuss this with the patient during transplant preparation and evaluation. During conditioning chemotherapy, the patient receives high doses of chemotherapy or radiation to prepare the body for the transplant. Conditioning chemotherapy helps kill any cancer cells in the body and makes room in the bone marrow for the new transplanted cells to grow. Transplantation is the actual stem cell transplant procedure, also called Day Zero. It is like getting a blood transfusion, and it all happens in the patient's room. Healthy stem cells travel directly to the bone marrow, where they will grow over the next few weeks through a process called engraftment. During recovery, the patient's body heals from the effects of chemotherapy, which may take 2 to 4 weeks. Side effects can be felt very differently from person to person and will be managed by the BMT team. Common side effects include fatigue, nausea, diarrhea, and fever or infection. Patients must work hard at maintaining activity level, fluid intake, and nutrition. During this time, we are also waiting for engraftment. Engraftment is when the new stem cells grow to make normal red blood cells, white blood cells, and platelets. This process takes about 2 to 3 weeks. Engraftment is important as it reduces the risk of infection, need for blood and platelet transfusions, and aids in the healing process. When patients return to their home environment, school, or work, they may feel particularly stressed due to fatigue and the strict precautions that will need to be followed to prevent infection. The transplant team will discuss these precautions and any post-treatment needs before discharge. Because of the high doses of chemotherapy received before transplant, transplant-related medications, and donor transplants, complications may occur for years or months after transplant. Moffitt patients are closely monitored by their transplant teams for signs of these complications and through long-term follow-up care. A long-term follow-up care plan will be discussed with the patient by the transplant team. From cancer patient to cancer survivor, any difficulties patients experience related to their cancer treatment can be addressed by the transplant team. Moffitt's BMT team is available to support both patient and family with the challenges of life before, during, and after cancer treatment.